Good morning. Most respected Shri D.R. Karthikeyan ji, Dr. Chandra ji, Dr. H.R. Nagendra ji, पूज्य साध्वी जी, श्री कौस्तुभाचार्य जी और इस सभागार में विराजमान लीडरशिप को रिप्रेजेंट करते हुए डिफरेंट वॉक्स ऑफ लाइफ से को रिप्रेजेंट करते हुए जहां आप सब महानुभाव जो सम्मिलित हुए हैं सबको मेरा नमस्कार. Dignitaries, esteemed guests, guests from abroad, and friends. It's a true honor for me to be here at the Global Conference of Meditation Leaders this morning. It's a true privilege, and I feel very humbled that I'm sharing the dais with leaders of meditation, leaders of spirituality of India. It's very humbling for me to be coming after respected Dr. Nagendra ji, जो उन्होंने अपने एक्सपीरियंस से, अपने कर्म से एक बिल्कुल नई डायमेंशन दी है योग को, मेडिटेशन को, स्पिरिचुअलिटी को साइंस के साथ जोड़ा है. आई एम वेरी वेरी humbled and thank you for this great opportunity. I have been tasked with the theme of scaling up meditation in the country. And because I represent Niti Aayog, which is the apex think tank of the nation, chaired by the Honorable Prime Minister, I'm attempting to put forth some ideas in front of you as to how meditation can become a way of life. We heard from respected speakers. I'm going to hear more about this. How meditation can change our society, individuals, communities, society, and nation. That is the power of meditation, I understand. And as I've said in the last year also, my earliest exposure, Dr. Karthikeyan sir, was in my AIMS, first year of my training at AIMS, where very path-breaking work was being carried out by stalwarts of neurology and neurophysiology, my teachers, who were examining the brain physiology of the yogis when they go into deep meditation. Some of the earliest work was done in the early 70s, and this is very much etched in my mind. So that exposure has been helpful in understanding the underpinnings of meditation, what it does to human physiology, human being, and the brain, and beyond, and the consciousness and the mind. Let me begin by saying we have heard multifarious benefits of meditation. If I begin by starting in the mental and emotional state, we are looking at this blessing to help us with relaxation, bringing calmness, helping in anger control, helping in reducing reaction, imparting more concentration, focus, better learning. Imagine, I want us to remember this something very important. Promoting learning, one pathway, an important pathway is meditation. But the empirical evidence says that it works. Better sleep, better memory, better emotional quotient, better relationships and teamwork. And then, of course, we heard specific advantages of meditation and role of meditation in mental illnesses, anxiety, stress, mood changes, depression, obsessive compulsive neurosis, bipolar. And I'm very emphatically would like to mention that we believe substance abuse problem is helped by meditation in a significant way, and more should be done in this regard. As an adjunct to medical therapy, health, pain relief, recovery, adjunct to stressful situations, heart conditions, cancer, as an adjunct for recovery, because it brings in positivity in the body through biological processes. And above all, of course, we heard now about spiritual awakening, higher consciousness, enlightenment, and inner happiness. Is there any other modality which can deliver so much to humanity? We also heard, and I think that's a very important point, and it's also my own understanding, improving understanding, that meditation is the heart of yoga, connecting yoga and yoga opportunities. And as yoga becomes more mainstreamed, the opportunity now is to include the meditation dimension of yoga overtly and systematically. That's my learning from Dr. Nagendra ji just now. So we have a great product. We have a great intervention. And now I like to align this to how we strategize delivery of interventions, say vaccine, or say a oral rehydration solution or a medicine, to the population, because they understand a little better on the health system. So you want to use this paradigm that we have an intervention. We call it intervention, something that changes life, improves health, like a vaccine, let's say. So we have a great vaccine. There is a target audience. And the target audience in other situations could be mothers or children or the elderly and so on. But here, every human being and the citizen is potential target. So the agenda is huge. Every one of us. There's no exclusion here. Some vaccines are targeted to children. Occasionally, some vaccines are for adults, and so on. But here it is a universal. It's an intervention for universal coverage of entire population, technically speaking. So I'm trying to build this paradigm of how to go about, and that could be a discussion that the leaders may like to take forward in thinking through. So we have an intervention, we have the target, and I'll come to where the target beneficiaries are. We'll come back to that. In between is the how part of doing it. This is the what, and this is for whom. The between part is how. In the health system paradigm, we call the middle path of the how and the enablers of how as the health system. And I want to use that analogy which can be adapted to this unique part, sir. The health system can be visualized as a railway track. If the intervention is the train or an engine full of goodies, full of wellness, full of vaccine, full of things that work and bring up better health to the people, the mothers, children, babies, adults, elderly, what takes it there is the health system. That's what makes it reach there. And we have to think about how a blessing of this kind reaches here. And those are the enablers. What are those? Policy. Decision that we have to be done. Stewardship. Thinking. Strategizing. First one. Second, infrastructure. Here, it may not be too much of infrastructure, but an example of an infrastructure could be, shall we say, an interfaith meditation room in colleges or workplaces. Perhaps not much. We can use other infrastructures of the hospitals and so on. But human resources, we need people who can impart the intervention to the target. And there are going to be many such individuals, and I'll come back to that in a minute. We need strategy for service delivery. When vaccines have to be delivered, individuals are in different places. You make a micro plan. You decide how to convene them and how you reach them. So you need a plan how to reach different categories of people. You also need information systems. And above all, you need, as a part of the health system, what we call as community mobilization. The Jan Andolan, as the Honorable Prime Minister puts it. Involvement, outreach, a buzz, the feeling that it is we are part of the journey. This is the rough part, the middle part. What in health is the health system, but this is essentially the how part of how the interventions reach the people. The goodness reaches the people. Education reaches the student through schools. The school is part of the system, teachers, and so on and so forth. So I like to visualize in this fashion. The first one, intervention is easy, and I'll come back to that a little one point later on, but that's clear. We know what it is, right? Largely. I speak for standardization. I'll come to that point a little later. We then have to understand where our target populations are. And that now goes to a real part of the discussion. Among the citizens who should become part and parcel of meditation uptake, shall we say, very special people are children. Absolutely, because the habits are formed in childhood. Second opportunity for habits and lifestyles happen during adolescence. For children, it's even more important, and I have said this before, because in the formative stage of the brain, things that we bring in there make all the difference. And imagine what meditation can do. In the earliest part of our life, starting within utero period, fetal life, and early period of life, the brain is increasing in size, but even more importantly, the neurons, the brain cells are making connections with each other. Each neuron, there are 85 billion neurons. And each neuron makes connections up to 1,000, 7,000 connections with different neurons. So a whole lot of the synaptic business is going on. That's how the neurons communicate. That's how the evolution, thinking, cognition happens. If at that time we give the right advice, right intervention, it will make a difference. So earliest period of life is important. I think one important site would be our Balvatikas or Anganwadi, where 3 to 4 to 5, 4 to 5, 4 to 6 years children can be brought into this habit. But then the real place where we can see a lot of action is the school. Sir has also said that schools में हम कैसे ले जा सकते हैं. स्कूल के ले जाने के लिए हमें टीचर्स को उसी भावना से कैसे तैयार करना होगा is the challenge. लेकिन the beginning for nation to change, the beginning cannot come after 28 years of life or 48 or for that matter 58. It should be introduced at that time. That orientation must be there. So, very often these things come to our lives so much later. We all can relate to that. When you meet a guru at some point, it has to become democratized. So children are special, schools are special, youth. Where is the youth located? Of course, homes, but then in colleges, hopefully increasingly in skill centers. They are outside the school, then they are working at workplaces. We have systems like NSS and NCC and youth organizations. That could be the channel through which all this moves. Then, of course, the workplaces have been talked about, the offices, the factories, the shops. Here there's also a challenge. A lot of the youth, working age people are not necessarily in beautiful offices or the corporate offices. How do we reach that? And perhaps for that bottom-up approach would be needed, but we shall not forget that their special effort has to be made for them. If they are in self-vocation, they are in small shops, they are construction sites, they need it. All of them need it. Of course, there are more urgent necessities and nobody can quarrel with them. खाली पेट मेडिटेशन नहीं होता है, स्वामी जी ने भी कहा ये, स्वामी विवेकानंद ने कहा, सबसे तो ठीक है, समझते हैं, लेकिन पहुंचेंगे तो वो पहुंचने के पाथवेज बनेंगे. सेल्फ हेल्प ग्रुप्स, पंचायती राज, विमेन्स ग्रुप्स, RWAs, armed forces system, police system, the prisons, and so on and so forth. If you visualize, then we can start seeing where the clusters of people are, where we can reach out. And then we have seen in the past how some of these national movements have touched lives of everybody. So this is the broader one, but then there are specific ones. And here I would like to underline the need for reaching out to the elderly, because what happens at that stage is we are more receptive. And whatever now can be done by way of embracing meditation should be done. An increasing population of elderly who are free from other vocations, largely can and should be reached as a special target group. Another important place I highlight is the hospital and health facilities, because that's a point where there is a place for meditation to improve health and to put the individual on a journey of positive health for future. That's a great opportunity. You are listening at that time. You are concerned. You are willing to change. Hopefully, can we enable it? Ayushman Arogya Mandirs, as a way where yoga is practiced, is already there. 1,87,000 such locations are there. And we build on that the meditation component systematically. And that time has come. I think this is the one message that comes from the dais today. Embed this into the yoga ecosystem, which by itself is moving very effectively, positively within the nation and beyond. That's a message I take in my learning. We keep in mind. De-addiction centers and prisons. De-addiction centers in particular is a place, and those who are affected by this, for their rehabilitation, injecting meditation as a modality. How is it to be done? Do we have models how it works? Are they effective? Are they got owned up by the families? A very important area for work, because this population, this group of young people are sliding away from the society to an abyss. If meditation can help, can we develop the tools to do it? Can we systematically pick it apart into a protocol-based meditation that can be incorporated? And so on and so forth. So this brings out how and where all this we have to reach, and I have tried to attempt to say who the key players in this journey would be. Of course, more needs to be spoken. But going forward now, there are very important enablers. And those enablers are the ones that I now like to touch upon in my last part of my submission here. ये सब करना है. इस तरह पहुंचना है. We are getting a sense of how to reach. The role that will be played by the society, by the leaders, by the mutts, by the other community systems in our country. But the target is every individual, starting with childhood, starting with youth, starting with adolescent, when the habits are being formed. No one can be left behind in this, to use the SDG analogy. I'd like to bring to your kind attention that we will need now 6 additional things. Firstly, I humbly submit that we collectively should bring about what I loosely may like to call as a standardized product. The meditation, to my humble understanding, has very core elements to this. And then different teachers, different shall we say formats, build on that and add additionalities. So there is a generic version, and then there are these more specialized and perhaps increasingly improving versions. What is needed is, like yoga, where the asanas have been systematically put for different age groups by the Ministry of Ayush and other leaders. Similarly, the core of meditation should be brought out clearly in a readable form, in a video form. That is the core. And there should be a possibility that as an individual, I can get into the journey. I need a teacher for me to move faster. But can an individual make a start if need be, if he or she is not so fortunate to be able to get? I know that there are materials, I know that there are YouTubes and so on, but then when we are promoting this as a national movement, just as we've done it for yoga, some kind of a prioritization and standardization and the core to be made visible, I think would be of help, but I'm happy to be educated. That's the first part. Number two, so that it is not dependent on my opportunity to meet a great guru. And that should not be away from the broad tenets of meditation, what I land up through an easily accessible material and information. Number two, capacity, stating the obvious. Teachers are very important. Physical education teachers, yoga teachers, are they good with meditation? I'm not sure. Have we trained them for meditation? No. When we're talking about teachers, is everybody ready to own yoga and meditation? Perhaps not. It will take a while. How do we select the right people to be the agents of change in a school? It just cannot come as a training program in a room and happen, because this is internal. You need to believe in this. You need to you have to practice this to be able to pass it on. If it is theoretical, it doesn't go across. It cannot be a didactic thing. It's so internal. So I submit how we do that would be for us to consider. Mental health counselors are being talked about in schools. Can they be engaged into this? So we need to decide who does it. We're trying to build a picture of the strategy to take it to scale. These are the nuances, and there are many more that I may not be in a position to cover. Doctors, convincing doctors, a great opportunity to convince doctors, convince nurses, allied health professionals, the physiotherapists, the dietitians, the clinical psychologists, occupational therapists, and so on and so forth. So you need to identify who the amplified range of teachers are emanating from the gurus, so that the workforce is visible. I'm not waiting for a God-given opportunity, but the opportunity out there to help the individual. 3, we will need materials which are valid, authentic material, authentic resources, and a consensus on the resources, so that people are not confused कि ये वो नहीं है, ये उससे ऐसा होना चाहिए जैसे कि आयुष ने योग के लिए बना दी शीट कि ये करिए, हम उसको लेके करते हैं तो हमें पता है कि सेफ है और राइट है, more than that, more than safe. So those standard materials and resource materials is the third thing that we need. Then we need outreach in a very big way, stating the obvious, Jan Andolan, brand ambassadors. We have to be mindful of the impact of social media. I'm sure a lot of us may be working on this, and I'm sure it is also a success to reach, but then clearly that is where the influencing happens, the other media. And then also for a lot of people, the bottom-up approach, what happens in rural India and small towns where dynamics are different and the more elite dynamics, how do we handle that? How do we bring this buzz out there would be part of our strategy. So that's outreach. My fourth point is research. If we create good science, and we have a lot of good science, but much more. For example, if a claim is made that those who have a meditation for, let's say, before getting into elective heart surgery or cancer treatment, and they undertake meditation in a systematic way in the course of their management and then of course continue, are they better off? In what way? It's anxiety? Is it recovery? Is it hormones? All this will help. Because today, the general way of understanding interventions is through the filter of science. And I think a lot has been done. Much more should be done. Nagendra sir also mentioned about the work that's being done at AIIMS. But big research paradigm is needed to convince the world and convince those who are not who are willing to be ready converts. That will happen. You spread the word, there will be more and more people. But I think if you bring in science, it's a game changer for that day. So research must be an important part. Systematic research, directed research on the biological pathways and clinical impact. And lastly, use of technology. So as mentioned in the last presentation, and I wish to put it the other way around. One is technology as apps and so on. But more importantly now, the most important, most disruptive technology at hand, namely AI. One aspect of AI, it will create more problems perhaps. But the opportunity for the world and India is how technology can be used for better life, better output, better welfare. And can there be an AI personal tutor which does the right things? Can we create that? Because we are talking about personalized, tutors for let's say education, learning. Part of this pathway runs through the learning experience. It may be tricky, or should it something that we should not do it? I leave it there. So AI can take us both the ways, both the sides. I hope that like any other sector in which AI is going to have an impact, the effort is use AI for the betterment. Use AI to our advantage. And that is something that could be a debate this year. Last year, perhaps it was not so visible. But this year, I wanted to make this last point for humble submission as to how we connect our efforts with the AI, which is already pervasive, but it will become all pervasive. It will have issues that wobble us, disturb us, but can it be taken to our advantage through some of the possibilities that are on the horizon? In the end, I would say that this is a blessing. Meditation is a blessing, life-changing for individuals, communities, societies, and nations, and for India to evolve as a unique society in our run-up to 2047, promoting meditation, embracing meditation on scale at the population level will perhaps be a great service in the history of Bharat. Thank you very much. Jai Hind.